sing. Great is thy faithfulness, O God my Father. There is no shadow of turning with thee. Thou changest not, thy compassions, they fail not. As thou hast been, thou forever wilt be. Great is thy faithfulness, great is thy faithfulness. Morning by morning, new mercies I see. All I have needed, thy hand hath provided. Great is thy faithfulness, Lord, unto me. Summer and winter and springtime and harvest, sun, moon, and stars in their courses above, join with all nature in manifold witness to the great faithfulness, mercy, and love. Great is thy faithfulness, great is thy faithfulness. Morning by morning, new mercies I see. All I have needed, thy hand hath provided. Great is thy faithfulness, Lord, unto me. Pardon for sin and a peace that endureth, thy omnipresence to cheer and to guide, strength for to live and bright hope for tomorrow. Blessings on mine with 10,000 beside. Great is thy faithfulness, great is thy faithfulness. Morning by morning, new mercies I see. All I have needed, thy hand hath provided. Great is thy faithfulness, Lord, unto me. Great is thy faithfulness, great is thy faithfulness. Morning by morning, new mercies I see. All I have needed, thy hand hath provided. Great is thy faithfulness, Lord, unto me. Amen.
Amen.
I hope we sing with understanding.
Happy Sabbath. Happy day. Nimemwinua mtu toka kaskazini, naye amepanda juu ya Nimemwinua mtu toka kaskazini, naye amepanda juu ya jua amepanda anijaye jina langu, naye atawajilia maliwali kama akanyagae matope na kama mfinyanzi afinyagae udongo. Nimemwinua mtu toka kaskazini, naye amepita toka mawio ya jua, amepita anitajae jina langu, naye atawajilia maliwali kama akanyagae matope na kama mfinyanzi afinyagae udongo. Mimi kwanza nitamwambia Sayuni, tazama hawa ndio, nami nitampa Yerusalemu mletaji wa habari njema. Na nitazamapo hapana mtu atakatika watu hao, hapana mshauri mmoja ambaye nikimuuliza aweza kunijibu neno. Tazama hao wote ni ubatili, kazi zao si kitu, sanamu zao ni upepo na fujo. Mimi kwanza nitawambia Sayuni, tazama hawa ndio, nami nitampa Yerusalemu mletaji wa habari njema. Na nitazamapo hapana mtu atakatika watu hao, hapana mshauri mmoja ambaye nikimuuliza aweza kunijibu neno. Tazama hao wote ni ubatili, kazi zao si kitu, sanamu zao ni upepo na fujo. Mungu Baba anena, yeye muumbaji, awapaye pumzi watu walio juu yake. Amesema atatulinda siku zote, utukufu wake atampa mtu. Ametukuka aweza yote, astahili heshima. Mcheni Mungu muumba. Mungu Baba anena, yeye muumbaji, awapaye pumzi watu walio juu yake. Amesema atatulinda siku zote, utukufu wake atampa mtu. Ametukuka aweza yote, astahili heshima. Mcheni Mungu muumba. Mimi kwanza nitamwambia Sayuni, tazama hawa ndio, nami nitampa Yerusalemu mletaji wa habari njema. Na nitazamapo hapana mtu atakatika watu hao, hapana mshauri mmoja ambaye nikimuuliza aweza kunijibu neno. Tazama hao wote ni ubatili, kazi zao si kitu, sanamu zao ni upepo na fujo. Mimi kwanza nitawambia Sayuni, tazama hawa ndio, nami nitampa Yerusalemu mletaji wa habari njema. Na nitazamapo hapana mtu atakatika watu hao, hapana mshauri mmoja ambaye nikimuuliza aweza kunijibu neno. Tazama hao wote ni ubatili, kazi zao si kitu, sanamu zao ni upepo na fujo. Mimi kwanza nitamwambia Sayuni, tazama hawa ndio, nami nitampa Yerusalemu mletaji wa habari njema. Na nitazamapo hapana mtu atakatika watu hao, hapana mshauri mmoja ambaye nikimuuliza aweza kunijibu neno. Tazama hao wote ni ubatili, sanamu zao ni upepo na fujo.
Tunasemaje? Church choir tutakaribisha mnenaji wa afternoon ya leo. So choir members tuingie ndani. Tukikuja ningependa tuimbe wimbo nambari 110 Kiswahili. 110. Choir members, tafadhali tunakuja for an item. Mhudumu anaanza saa 9 kamili, so tuingie ndani. Mlango uko wema. Sing. Mlango uko wema, mlango wazi huo, Yesu ameufungua, na hakuna kufunga. Mlango wazi ajabu uliachwa wazi kwangu, 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 wazi, wazi kwangu. Mlango ukaa wazi, watu waokolewe, maskini na matajiri wa mataifa yote. Mlango wazi ajabu uliachwa za mwendo, msalaba ukubali, amana ya upendo. Mlango wazi ajabu uliachwa wazi kwangu, 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 wazi, wazi kwangu. Msalaba tutabeba daima na furaha, pendo wa Yesu hushinda, tunainama kwake. Mlango wazi ajabu uliachwa wazi kwangu, 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 wazi, wazi kwangu. 5:23 English. Kwaya awako? Awako? 5:23 English. Kindly projects. 523. My faith has found a resting place. Let's see. My faith has found a resting place, not in a man-made creed. I trust the ever-living one, that he for me will plead. I need no other evidence, I need soul is resting on the word, the living word of God. Salvation in my Savior's name, salvation through his blood. I need no other evidence, I need no other plea. It is enough that Jesus died and rose again for me. The great physician heals the sick, the lost he came to save. For me his precious blood he shed, for me his life he gave. I need no other evidence, I need no other plea. It is enough that Jesus died and rose again for me. Tutasimama na Psalm 111. Kindly, Elder Eric, join us here. Kindly. (111) Kiswahili. Tabibu mkuu huyu, sing. Tabibu mkuu huyu, Yesu mwenye huruma, atule ibene malaika, sifa za wana wetu, jina la pekee kwetu ni la Yesu Bwana. Mwana-kondoo msifuni, msifuni Mwokozi, hatia zote na dhambi huziondoa Yesu. Imbeni malaika, sifa za wana wetu, jina la pekee kwetu ni la Yesu Bwana. Hakuna jina jingine linalofaa sifa au kutufurahisha isipokuwa lake. Imbeni malaika, sifa za Bwana wetu, jina la pekee kwetu ni la Yesu Bwana. Naye atakapokuja na utukufu wake, tutafurahi milele kukaa kwake Bwana. Imbeni malaika, sifa za Bwana wetu, jina la pekee kwetu ni
Tuamini na tuamini na tuombe. Asante Mfalme Baba wetu wa mbinguni, tumekuja kwako mchana wa leo tukiwa na wingi wa shukrani kwa ajili ya uhai. Umetulinda Sabato njema na mambo mema. Asante kwa maana tumeanza vipindi zingine za mchana. Tunakualika uwe nasi tukianza, utubariki tutakapomaliza, jina lako liinuliwe. Hiyo ndio ombi yetu katika jina la Yesu tumeomba na kuamini. Karibu sana katika masaa ya afternoon. Mungu ni mwema na siku zote. Sabato njema na mambo mema. Mbarikiwe sana na asante kwa kuchukua muda wenu wa kurudi saa 8. Asante, tutakuwa pamoja katika mafundisho kidogo kuhusu afya ya meno zetu. Na siku ya leo tumebarikiwa kupata daktari kutoka hapa kliniki karibu na kwetu hapa, ambaye atatuzungumzia mingi kuhusu meno yetu. Kwa jina hiyo daktari anaitwa Dr. Gideon, na akisimama atawaeleza mengi. Ni wangapi wanamkaribisha pamoja nami? Asante. Karibu daktari.
God is good and all the time. Happy Sabbath. My name is Dr. Gideon Manaita. I'm a dentist at Elephant Dental Embakasi branch. We are located at just right opposite Nyayo Gate B, MIG Plaza. I'm very grateful this afternoon kwa kukaribishwa. We have had an invitation to come and do the health talk, and specifically I'll be doing a talk about oral health. Now, oral health is very important to our overall health, and it is our responsibility to promote and to make sure our oral health is perfect, because health is a gift from God. So this afternoon I'll be covering a few topics very briefly, just 4 topics. And then afterwards, if you have any questions, you'll be free to ask. So the topics I'll be covering very briefly are: 1 is basic oral hygiene, 2 is dental care in pregnancy, 3 is a condition called fluorosis, and 4 is the role of acidic drinks in tooth erosion. So, to my first topic, basic oral hygiene. I believe we all know that we are supposed to be brushing our teeth, but do you really ever ask yourself why? Why it is important to maintain a good oral hygiene? A really big problem that we face concerning our dental health is what we call dental cavities and tooth decay. It is the most common dental disease that we encounter as dentists. And the reason why oral hygiene is very important is because it is the primary prevention method to prevent cavities and tooth decay. So what is good oral hygiene? Good oral hygiene is brushing twice a day. In my experience as a dentist, I've come to realize a lot of people just brush once a day, and that is usually in the morning. But today I want you to understand that brushing less than twice a day is actually considered poor oral hygiene. So we should all strive to brush at least twice a day. And what entails good oral hygiene apart from brushing twice a day is we are all supposed to use fluoridated toothpaste. When I say fluoridated toothpaste, I mean toothpaste that has fluoride. Fluoride is important in toothpaste because it helps to prevent cavities by strengthening the teeth. We also need to be using a toothbrush that is medium to soft bristles. And the reason being, if you use a toothbrush that has very hard bristles, it will be too hard on your gums, and you'll end up injuring your gums when you're brushing. So you brush 2 times a day, you use fluoridated toothpaste, and you use a brush that has medium to soft bristles. Another thing that most people don't really adhere to is flossing. Flossing is using the thread to clean in between the teeth. I'm pretty sure most of you have used floss once in a while, because I know not very many people use it regularly. Because a toothbrush cannot really clean in between the teeth. The only thing that can clean in between is the floss itself. So that is what entails good oral hygiene. Now, that applies to adults and children from age 2 and above. I say 2 years because at 2 years is when we introduce a toothbrush for babies and toddlers. At 2 years is when we introduce toothbrush. So someone may ask, what do we do before 2 years? So what you need to understand is the moment teeth grow for the babies, some form of cleaning has to be done. You cannot just leave them like that. There has to be some form of cleaning. And so for babies below 2 years, we usually recommend you use a clean cloth dipped in warm water to wipe the teeth, at least once a day for the babies. And most especially after uji. Because now when you give the baby a bottle of uji, akikunywa, and then they just stay like that, it really brings problems. Because I'm pretty sure most of you know that sugar is not really good for your teeth. Sugar is how you get cavities. So when the baby takes uji and it has sugar, alafu akai hivo, when the sugar sits on the teeth, the process of getting decay and cavities start. So what you need to do is, after the baby has taken the uji, just take a clean cloth, dip it in warm water. You can even put warm salty water kidogo, and you wipe the teeth. That will really help to prevent cavities that we see in small children. A lot of times I've seen, and I'm pretty sure pia nyinyi meona, watoto wa miaka 3 years, 2 years, wengine 4 years ambao meno za mbele zimevunjika, zimekuwa fupi, and then they are black. And some parents tend to think it's antibiotics, which is not really accurate. Inakuanga ile scurry from uji, scurry from the sweets they take, is what really damages those teeth. So wiping the teeth for children 2 years and below will really help to prevent the cavities. Now I go to topic number 2. I had said we'll also talk about dental care in pregnancy. Now, pregnancy tends to predispose women to a few dental problems. One of the problems is gum issues. When someone is expectant, at some point they may experience bleeding gums. The gums may be a bit swollen, and that is usually because of a few hormonal changes that happens during expectancy. Those changes, they make the gum very sensitive to plaque. Plaque ni uchafu. Plaque ni mabaki ya chakula ambayo imekalia kwa meno. So the body becomes very sensitive, so such that if you have any plaque, your gums start to react very fast. They start to bleed. They bleed frequently. Ukiguza na bleed, they tend to swell. So for expectant women, it is really important to maintain a very good oral hygiene, because if there's no plaque on your teeth, you'll not experience any bleeding. Another problem is that usually a lot of women during the pregnancy period, they get a lot of toothaches, a lot of cavities, and that is usually because during pregnancy the nutritional requirement goes up, especially for minerals. And as we know, there's this mineral called calcium, which is very important in strengthening teeth. So if you're not able to take in an optimum amount of minerals, your teeth could suffer. That is why so many people get cavities and toothaches during pregnancy. So to curb that, you usually have supplements for calcium, and you should also try to take in a very balanced diet, which will really help in maintaining the health of your teeth and also in ensuring the development of the baby is optimal. Something else that people really ask about is dental visits and dental checkups during pregnancy. Some people are skeptical because they really fear about the wellness of the baby when they probably come to the dental clinic. And this afternoon I'd like to tell you that dental checkups are important even during pregnancy. And this is because some dental conditions, if left untreated, they can even cause risk, they pose a risk to the baby. So it is really important that if you have a dental problem, even if you're expectant, it's very important to visit the dentist. You have nothing to fear, but of course there's a few things we avoid during that period. We usually avoid x-rays. Another thing we probably avoid is doing dental extractions, especially in the last trimester. But other forms of treatment you can very safely get them done, like fillings, cleaning. They can be safely done even during expectancy. And about checkups, it's not only for the expectant women. Everyone should be getting dental checkup. Ideally, it should be every 6 months. Every 6 months, you just go for a checkup because some dental conditions can sneak up on you and you wouldn't know. So it is very important just to go for checkup. Or if you feel like twice a year is too much, even once a year is acceptable. But as long as at least every year you've gotten your teeth checked by a dentist. So to my third topic, I wanted to talk about a condition called fluorosis. And to understand fluorosis, first we need to know what fluoride is. If you've heard about fluoride, fluoride is an element that is found, number one, it is naturally occurring in water. So water usually has fluoride. And fluoride is also found in toothpaste. So what does fluoride do? Fluoride is very important in strengthening the teeth and therefore preventing cavities. And that is just when fluoride is at the recommended level, especially in water. If you drink water that has the recommended amounts of fluoride, it will help to strengthen your teeth. So the only problem occurs when the fluoride content, especially in water, is anything above the recommended amounts. That is when now we get problems. And it is very common around here in Embakasi. I'm pretty sure you've seen kids, mnaona meno are brown. That is what we call fluorosis. And it happens when you consume maji ambayo iko na fluoride kupita kiasi. And I know most of you, maji ya kunywa ni ile ya kurefill. You take them from the refilling stations. Hizo huwa zimetolewa the excessive fluoride by a process called reverse osmosis. So that is okay. But mali wengi wetu tunapatikana is cooking. Because now utakunywa the one that you've been refilled at the refilling station, but kupika, unatumia the salty one. That is how our kids are getting fluorosis. That is how our kids are getting brown teeth. So I believe wote tumeelewa what fluorosis is, yeah? Something very interesting about fluorosis is that it only affects developing teeth. So that is teeth of children 8 years and below. 8 years and below is when the permanent teeth are still developing. So the permanent teeth, they absorb the excessive fluoride, and it will show up through the discoloration. And another thing is also that it only affects permanent teeth. So you'll see your toddler has very white teeth. Lakini ikifika wakati wa meno kutoka, they shake, mnatoa, zingine zikimea, you realize, how come they are discolored when the baby teeth were very white? It's because fluorosis, unfortunately, only affects permanent teeth. So maji ambayo mtoto anakunywa when they are 8 years and below is very important. So prevention is basically avoiding the salty water at all costs, drinking na kupika. But since I know most of us are already affected what you can only do now is treatment. And I'd like to inform you that there's always a solution. So for children with discolored teeth, we always do whitening. We also do it for adults, but it's a bit different. And on to my last topic, I wanted to discuss the role of acidic drinks in tooth erosion. So in the recent few years, there's been a rise in number of people who consume, who drink concoctions. Sijui kama tuko hapa. Kuna watu wa concoctions huku. Watu wa kunywa lemon water with acid, with apple cider vinegar. Yes, so we have a problem hapo kwa the concoctions. A lot of people take them for a few reasons, like to boost immunity, some for detoxification. So yes, they work. They work, especially the lemon water. It really works to boost immunity and to detoxify. But now the problem comes hapo kwa acidity, because lemon is very acidic. It is very, very acidic. And what happens is when you take that drink regularly, the lemon water, what it does is that it erodes the teeth. The outermost layer of the tooth is called enamel. Enamel is very white. So what happens when you take the lemon water or the concoction, being very acidic, it wears away. It erodes the enamel. And the enamel is supposed to be protecting the tooth. So I get this a lot at my office, where someone comes in, they're complaining of tooth sensitivity, they cannot take cold water. Even when they take hot tea, it's very sensitive. And even in extreme cases, there's even sensitivity when they try to brush. Even when the tooth is touched by a toothbrush, it feels sensitive. And when I look at the teeth, there's no cavities. I just noticed there's a lot of erosion. There's significant erosion on the teeth. And when I ask a few questions, I realize ni mtu amekuwa akikunywa concoctions every single day, especially the lemon water. Mtu anaikunywa kila siku, or at least unapata anakunywa 4 times a week. So it is really damaging to the teeth. So kwa wale yote ambao tunakunywanga the lemon water, you might need to find an alternative. Or if you have to take it, you really need to cut down on the consumption. So for example, mtu ambaye anakunywa lemon water daily, cut it down to maybe once a week, or maybe once in 2 weeks if you can, to save your teeth. Because now when the enamel is eroded, it exposes the layer that is just beneath the enamel. That we call that the dentine. The dentine is yellow and it is very sensitive. So to save yourself, kabla hujaanza kuwa na sensitivity, if you can stop it, just stop. If you can't, cut down on the consumption. Punguza frequency kabisa. If it's daily, punguza. Maybe once in a while. Another thing that will probably help is using a straw. If you have to take it, you can take the drink using a straw. That way it will reduce the amount of contact with the teeth. It will reduce the contact of that acidic drink with the teeth, and that will reduce the consequences. Another thing you could do is, after you've drunk such a concoction, just rinse your mouth afterwards, so that you kind of neutralize the acid. You just rinse your mouth with water, or if you can drink something that is the opposite of acidic, so something alkaline, something like milk. If you could drink that afterwards, it could really save your teeth. Something else you could probably do if you have taken something acidic is you have to avoid brushing within the first 30 minutes after taking it. Because now the acid in the lemon, for example, it makes the enamel very soft as it is eroding it. So when you brush your teeth immediately, you'll be really helping to erode, because now the enamel has been softened by the acid. Okay? And of course, if you're a victim, no need to worry, there's always a solution. So that is it from my end. I believe we have all learned something about our oral health, especially regarding prevention and avoiding those potentially damaging habits. I don't know if you have any questions. Any questions from the audience? If you don't have any, wacha tena niseme asante on behalf of Elephant Dental Embakasi for inviting us here. Na ningetaka kuwa offer, if any of you wanted to see the dentist, we will do a free consultation at our clinic for the church members. Free consultation, and then now if you need anything, we can talk about it. And of course, you'll also get a few discounts. Yes, you get a few discounts on some procedures. You're very much welcome. Nimesema tuko pale opposite Nyayo, Gate B of Nyayo Estate, MIG Plaza. We take insurance, we also take cash, and we are a bit flexible, so msiogope. Na vile nimwambia watu wa kanisa mtapata discounts. So karibuni sana. Yes. I can also share our number. She just reminded me something. So kwa wale ambao, I spoke about dental cavities and tooth decay. So kwa wale ambao wanaumwa na meno, wale ambao kuna shimo kwa meno na hata hawaumwi, basically what we do is if you have a cavity that is a hole na haumwi, we just clean it very well and do a filling. So filling ni meno ambayo iko na shimo na hayumi. But if it has a cavity and it is paining, now that is when you do root canal treatments. Do you come and root canal treatment? I believe you have. Yes. So root canal treatment is for meno ambazo iko na shimo na inauma. That is when you do root canal. Then kama hayumi, we do fillings. Kwa watoto and even adults, the discoloration, we can do what we call masking, ambayo ina whiten ile meno ambayo imekuwa discolored na maji. We can also do the same for adults, but for adults kuna option nyingine ambayo inaitwa crowns or veneers. But of course when you visit us, we'll give you more information. We also do tooth extractions. Ingawaje mimi huwa nasema meno ambayo inang'olewa ni meno ambayo haiwezi okolewa. If it can be saved, we really try our best to save it. Mtu asikimbiliange kung'oa meno. So if a tooth can be saved, we save it. Otherwise, that is it from my end. I can share our number in case anyone needs to give us a call. Our office phone is 0741 183 364. Feel free to give us a call whenever you wish, and also feel free to visit us. 0741 183 364. Thank you very much. Unfortunately, we don't have SHA yet, but it is in the works. Yes. But we take most of the other insurances. Yes. Any other question? The number? 0741 183 364. That is our office number. Thank you very much.
Thank you, daktari. Umejienjoy? Umesikiza, at least umepata namba ya kuuliza maswali kama mtauliza saizi. Asante kwa mafundisho. I hope itatusaidia sisi na watoto wetu. Wamama kama sisi wakati tulikuwa tunapata watoto, tulikuwa nakula mawe sana. Sasa hii meno ndio inaanza kutoboka. Kwa hiyo tuangalie wamama wadogo. Wakati huu tena tunakaribisha dada yetu Timina aongee kuhusu mental health kidogo ndio tumalize. Karibu dada.
Happy Sabbath. Happy day. Before I start my topic, I have a question to Daktari First of all, thank you for the wonderful presentation. I work also in a hospital, and sometimes we receive patients who complain that they did a root canal, but they still feel the pain. I don't know what happens, because I tend to think root canal is a procedure where you kill the nerves, and so they are not supposed to have any pain. So please shed some light.
That's a very good question. It's a valid concern. And the thing is, root canal, like you've said, it's a procedure about killing the nerves of the tooth so that it stops paining. But now, as dentists, we have a very big problem with root canal, and the problem is compliance. So root canal, most of the time, we don't just do it in one appointment. Most of the clinics, utapata, we do it in at least 2 or 3, also depending on the specific tooth. So a very big problem we have, like I said, is compliance. So someone comes for the first appointment, and the first appointment usually takes care of the pain totally. But hata kama mtu amepona inakuanga hatujamaliza. So a very big problem is we do the first stage, mtu anapona, and then you tell them you're supposed to come back in a week or 2 weeks. Watu wengine wakipona hivi, hautawaona tena. And now the problem is when you go away with something that is incomplete. Yes, imetulia for now, but as long as haijamalizika, it just becomes a matter of time before iamke. And the day inaamka, utasema daktari ulifanya root canal haijapona, and it's most of the times the patient who did not finish the treatment. So that is the major problem. Otherwise, when you come for all the stages, if for example we've decided we do it in 2 or in 3, if you come until daktari anakuambia hii tumemaliza, most of the time utapata shida. Shida tu ni hapo kwa compliance. I hope mmenipata.
Asante kwa hiyo clarification. Daktari anaomba kuondoka, kuna patient anamngoja. So tutamruhusu aende. Next time yule anamhitaji, amepeana namba, ama mwingine atamuona huko nje akiondoka. Barikiwe sana. Tunakaribisha dada yetu aendelee na mental health.
We are going to talk about mental health, and as we know, it has become a burden right now in Kenya and also the whole world. We'll read the book of Matthew, chapter 11, verse 28 to 29. It says, "Come to me, all you who are weary and burdened, and I'll give you rest. Take my yoke upon you and learn from me, for I am gentle and humble in heart, and you will find rest for your souls." So basically this verse, it reminds us that God cares deeply about our mental and emotional well-being. He offers peace and comfort to us in times of struggle, because we know that mental health is usually a struggle. Let me just give what mental health refers to. It refers to emotional, psychological, and social well-being. Emotional, psychological, and social well-being. And it influences an individual on how to think, how to feel, behave, handle stress, relate to others, and make decisions. So therefore, if you have good mental health, you are able to cope with the challenges of life, because we know in this life, there are so many challenges. And you can still work productively, and you will maintain fulfilling relationships. That means if you are a husband, you will have a good relationship with your wife. If you are a child, you will have a good relationship with your peers, your parents, and your siblings as well. And therefore, that's why mental health is very, very important. When we look at the prevalence of mental disorders, that's why we are talking about mental health, because the prevalence has gone up really, really high. There is a study that was done in 2021, July, by Kenya National Adolescent Mental Health Survey. Unfortunately, it's our adolescents that are affected a lot. And this study was done to adolescents aged 10 to 17. And it revealed that 44.3% of adolescents experience mental health problems in 1 year. That's a very high percentage when you think about it. And while 1/8, that is 12.2%, they meet the criteria for a mental disorder. That is defined by something called Diagnostic and Statistical Manual of Mental Disorders. That is what we use when probably you are diagnosing mental disorders. And so this is a very high percentage, bearing in mind that right now we are going through so many challenges in life. There's also a lot of drug abuse, and our youths and adolescents are the one really using the drugs, and that's why the rate of mental disorders is really high. And this one, it has an impact. As a country, there is an impact economically, because studies have shown that actually in Kenya, according to the Ministry of Health, the country loses approximately 62.2 billion annually due to mental health. So that's a lot of money. Hiyo ni pesa tungefanyia maendeleo, but now we are losing that money on mental health. And actually, even recently, I don't know if you know about this, there was some legal development. If someone commits suicide, wants to attempt suicide, nowadays, they are not criminalized. Kitambo, they used to, if you commit suicide and it fails, then you are in trouble because you will be imprisoned. But nowadays, that was removed because of mental health. And that is because of a disorder called depression. You know, when you are depressed, you have suicidal thoughts, and you can easily attempt suicide. So instead of criminalizing you or taking you to prison, they would rather you go for a mental checkup so that they can establish if you are really okay or you have a mental disorder. It is a very broad topic, but I will just touch the basics, and then with time we'll continue learning more and more about mental health, because that is what is affecting most of us today. So let's look at the causes. What are some of the causes of mental health issues that we have? Normally they are very complex, but we will try and look at a few of them. One is the biological factors. This is about genetic or family history of mental health conditions. So if in your family tree, probably you had the probably history of depression, then most of the family members will have the same. So that is what is meant by biological factors. There is also physical injuries or trauma to the brain. That is biological. That means probably if you got an accident, a very severe one, and you got head injury, then that one can predispose you to mental disorder. Number two, we have psychological factors. These are childhood trauma or abuse. Mostly nowadays, people tend to, in adulthood, they tend to behave in a certain way, and mostly we say it's because of the influence of childhood traumas. Whatever you went through as a child, maybe your parents didn't know any better to take care of you, Maybe you went through very hard situations, conditions, your background was really, really hard. And so now when you're grown up, you get affected. You can get mental a disorder because of the traumas that you had, or abuse. And probably, for example, if you were molested when you were a child, you were abused when you were a child, then this can really affect you. There is also chronic stress or unresolved emotional conflicts. Chronic stress, this is whereby, like all your life, you're always under stressful conditions. This is where you're just working on adrenaline. You know, when you're stressed, there is a hormone that is produced, and that hormone, it harms the body. And more so, it harms your psychological well-being. That one can cause a mental health issue. There's also negative thought patterns. Wewe tu unajua, mi maisha yangu haijawahi kuwa mzuri, mimi huwa sina pesa from January to December, every year, mimi huwa nina shida mingi. You have negative thoughts all the time. That can affect you. And that's why we are told that please affirm positive energy in your life. And one of it is actually coming to church, fellowshipping, worshiping. You are attracting the positive thoughts and positive energy. It keeps your mental health in check. But if you're always going through sad moments, bitter situations, that will really make you go through mental issue. And sometimes you might not even know that you have a disorder. Another cause could be environmental factors, and this could be social isolation or loneliness. Mostly the prisoners. If you talk to them, or if you have heard stories or visited them, there are some of them who just decide to commit suicide because of that loneliness, because of the isolation. It is a very, it has a very bad effect on your mental health. And sometimes one of the tortures they do to criminals, they put you in a dark room, you're all by yourself, without nothing, so that loneliness can really affect you mentally. There's also exposure to violence or conflict. If you're exposed to violence, war, maybe unachapwa kila siku, that can also affect your mental health. There is financial instability or poverty. Poverty. Let's run away from poverty. It can cause mental health. You all understand, but what it means to be poor. It's not a good state, so it can affect you mentally. There's also lifestyle. Lifestyle, mostly this is where our youth fall. Substance abuse, that's alcohol and drugs. So if you keep taking alcohol, you keep taking those drugs, they can really affect your mental health. There's also lack of physical activity or poor nutrition. You just sitting there, you're not exercising, you're not fit, and you're not feeding well. Because remember, our bodies are usually nourished by what we take in. The food that we take in is what takes care of our body. And so if you don't observe your diet, then you tend to affect your mental status. There's also sleep disturbances. That's why we are told, tulale. We need 6 to 8 hours of good sleep. But most of us, tunatafuta pesa. We are always up and down, sleeping 2 hours or 3 hours. That's not enough at all. We are really disservicing our mental health. Those are some of the causes, generally. And let's look at signs and symptoms. How will you know that you have mental health disorder? Or how will you tell that probably your child or your family member or someone you're close to or your workmate has a mental disorder? So these are the things that you must check out for. There is emotional symptoms. Remember, we said mental health will affect your emotional well-being and your social well-being. There is persistent sadness. You are always sad. Nothing seems to make you happy at all. That one, that is a symptom, actually a sign that you are not okay. There is anxiety and irritability. Anxiety ni ile unakaa kushtuka. Kitu kidogo unashtuka. You cannot handle a situation. That means you need to really go for checkup. There's also a feeling of hopeless and worthless. You feel like you are not important. Your self-esteem is very low. If you ever feel that way, then please go for a checkup because it means you are not okay. There is also behavioral symptoms, the way you behave. You are withdrawn from your friends and family. You just want to be alone. You don't want to interact with anyone. You're always maybe at work. You're always at your work, your desk, all by yourself. Please, it is not normal. Because human beings are social animals. You need to interact with people. And if you find yourself, you don't feel like talking to anyone, you just want to be on your own, then kindly go for checkup. There's also loss of interest in activities you once enjoyed. Probably you liked a hobby, playing football, then all of a sudden you lack the interest. Nothing seems to interest you at all. Kindly, you need to go for checkup. There's also changes in eating or sleeping patterns. You get insomnia, you can't sleep, and eating disorders whereby probably you want to eat too much. Ushaisikia mtu anasema ati when I'm stressed, I really want to eat. You never get satisfied. That is one of the symptoms. We also have cognitive symptoms. These cognitive symptoms are like difficult concentrating on making decisions. You can't concentrate. You're not a child, because children, the maximum time they can take to concentrate probably is 4 minutes. But imagine you're an adult, but you cannot concentrate. Your thoughts are all over. And you can't even make a simple decision concerning a problem. That is a red flag. There is also persistent negative thoughts. That one we have talked about it. Suicidal thoughts or self-harm. You feel like you're worthless, you just want to die. You feel like you want to harm yourself. Probably you want to, mostly what happens, people cut themselves with razors, self-harm. It is not normal. And then there is that physical symptoms, like fatigue. You're always very tired. Mtu anasema tu, mi huwa nimechoka, siwezi simama, sitaki kutembea, nimechoka kila wakati. Or low energy. There's also unexplained aches or pain. The body inakuuma kila mahali. And I know most of us maybe have experienced this. Unaumwa na mwili kabisa, and when you go for tests, you go for checkup, you find there is nothing. Like there is no condition, all the tests are okay. But mwili inakuuma kabisa, then that means your mental health is not okay. Or also change in appetite or weight. You eat so much or you eat very little, then you find yourself maybe you gain weight or you lose weight. That is not okay. Those are some of the signs, and if at all you've observed that, because we don't want to take anything for granted, you could have 1 or 2 symptoms. Just go for a mental health checkup. Just walk in a hospital, talk to someone. Talk to someone before it's too late, because the next time you will be thinking about suicidal thoughts. Na ndio hiyo tunasikia mtu amejinyonga. We don't want to lose people through suicide, because you can always be saved from that. So we will look at some conditions, mental health conditions that are common. We have depression. whereby, and that is the most common one, although kila mtu anasemanga tu, mimi niko na stress, niko na depression, but they're really, okay, there is a way we diagnose depression, but that is the most common one. You can have stress, but it is not depression. And so we'll learn about the difference. So depression, it's a mood disorder that causes persistent feelings of sadness, hopelessness, and a lack of interest in activities. You just want to be, ile mtu anasema niache tu, I just want to be alone, I want to stay alone. That is a sign of depression. And symptoms, you can have fatigue, you're always very tired, sleep disturbance, change in appetite, and suicidal thoughts. Treatment, I will just talk condition plus the treatment. So the treatment normally for depression, seek medical advice, go to the hospital. You can also do a physical activity. You can go enroll for gym, or you can just do your own exercises. You can walk, it's called brisk walking, or you can even skip a rope. You can run, just to make sure that you improve the blood circulation to your brain and help with that. And also you can seek social support. As we said, human beings are social beings. Usikue hapo uko peke yako, you don't want to talk to someone. Probably, if you talk to someone, whatever you're going through, they went through it and they came out with some answers, you know. So you could be quiet and there is some help somewhere from people around. So please, you can seek social support from people that you trust, people you can confide into. We also have anxiety disorders. Anxiety disorders, at one point or another, probably you have gone through it. This includes generalized anxiety disorder. There is the panic disorder where you have that panic attack. A panic attack, majorly, it's like you have palpitations, your heart beats so fast, and you feel like there is some fear in you. That is the anxiety disorder. There is this phobias, it's called phobia. Phobia is just a fear. You feel like you're really fearful of something that you actually might know or might not know. And the symptoms of anxiety disorder, it's excessive fear or worry. There is restlessness, that rapid heartbeat, and difficulty concentrating. Unakaa tu, you are panicking. That is anxiety, and it is not normal. It is a health condition. Treatment for the anxiety, you can, of course, seek medication. You can be taught relaxation techniques. If you go to the psychiatric professionals, they will teach you how to relax. And there is also lifestyle changes. You can probably, because of your lifestyle, that's why you are facing the anxiety. So you can do lifestyle changes as well, and that will help. There is another condition called bipolar disorder. This one mostly you might not be familiar with because it's the professionals who diagnose it. It is characterized by extreme mood swings. Huwa tunasema wamama wako na mood swings. Sijui kama ni bipolars, I don't know. But women, mostly it's because of the hormones. But even male, they can have the bipolar disorders. The extreme mood swings ranging from maniac episodes. Maniac is where you feel so happy, like you're in a very happy mood. You can be in a very happy mood, then 1 hour later, you are very sad. Very, very sad, a depressive mood. So that is a bipolar, like you fluctuating. You have two moods, extreme ones, almost at the same time. The symptoms for this is changes in sleep patterns, energy levels, and behavior. Treatment, there are mood stabilizers. If you go to the hospital, they can prescribe some medication that will stabilize your mood. There's also therapy, and they maintain a structure for you so that you are able to follow, so that you avoid the fluctuations in the mood. There's another one called post-traumatic stress disorder. This one usually, the people experience it at our military police. They actually, when they go out there, huko Somali kupigana, they encounter very severe, bad, let me say, images or situations. Iyo kupigana na watu, and people, you kill so many people, it's not easy. Or your friends, when you go for war, your friends die, unabaki peke yako, and all that. So they suffer that post-traumatic stress disorder. And even some of us also, you go through a very traumatic condition. So when something triggers what you went through in the past, then you have that post-traumatic. So it develops after experiencing or witnessing a traumatic event. And actually, even the most recent one, the explosions that happened here in Muradi, there are some people who still have that PTSD. Akiona moto ama akiona nini, and it triggers, then they start panicking. So symptoms of post-traumatic distress disorders can be flashbacks, nightmares, emotional numbness, or heightened anxiety. So when you're reminded of the situation that you went through, the traumatic situation, you just freeze or you become very anxious. It has a treatment, and that one is trauma-focused therapy. There are people who are specialized who offer that, and mostly it's through counseling. So most of the time when the officers come from war, they are taken for counseling. They are taken for counseling just to help them cope. There is another one called obsessive compulsive disorder, OCD. People say it as if it's a very normal thing. Mi niko na OCD ya usafi, niko na OCD sijui ya nini. It is not normal. It is a condition. It is a condition, and it is characterized by unwanted and intrusive thoughts, obsessions, and repetitive behaviors, which are compulsions. So examples, symptoms, you can be doing excessive hand washing. Unapata tu kila kitu, we unafeel everything ni chafu. Hata mtu mwingine akiosha, you want to do it again. Because you feel, hii si safi, I want to do it. So you will be washing a lot, maybe checking or organizing due to underlying fears. Mtu aki-organize kitu, you want to come and recheck, you want to organize it, you feel like nobody can do it as perfectly as you, so you want to do it. So that is OCD, and it is a mental disorder. The treatment is cognitive or behavioral therapy. There are people who can take you through that, the professionals, and there is also exposure therapy and medication. So maybe you can be exposed to whatever you feel it's not right. So that exposure can help you be able to cope. There is another condition called schizophrenia. Schizophrenia is a severe mental disorder affecting thoughts, emotions, and perceptions. Schizophrenia is whereby people present with hallucinations. Hallucinations, delusions. Hallucination is whereby we unakaa hapo, unaona mtu, according to you, unasema mi naona mtu ananikimbiza, anataka kuniua, but other people cannot see. It is in your head. So you will see that mad person running, literally running for their lives. They think that someone is after them, but ni hao tu wanaona, but it's imaginary. And delusions, unapata mtu anatembea akisema mimi ni daktari. Have you guys ever met a madman akisema yeye ni daktari? Kwanza yeye ni daktari mkubwa sana Kenyatta. That is schizophrenia. There is also disorganized thinking, just thinking their own things, like thoughts that are not in reality, just out of the norm. They also social withdrawal. They don't stay with people. That's why they will run away from home. Ataenda kukaa mahali, maybe in a market somewhere. They are there, seated there. They are not okay. That is what we call schizophrenia, and it is the most severe one. But I don't know why we just leave these people there. They are our relatives. They are people we know. But we leave them on the streets, and yet there's medication. They can be given medication and they become okay. They can be given therapy and they become okay. So if at all you have a relative or you have someone you know with that condition, usimwache uko kwa streets. You can organize so that they are taken care of. We also have eating disorder, which is a mental health condition. This eating disorder, it includes anorexia nervosa. There is also bulimia nervosa. There is binge eating disorder. Anorexia, mostly it's for girls, young girls. They don't want to eat a lot. They don't want to gain weight. They want to maintain a figure. You know, that's what they say. Staki kunona. I just want to have a beautiful, nice figure. And so they don't eat well. There is bulimia. Bulimia now, this is the opposite one, where you eating a lot, you gaining a lot of weight because of just you're not observing your nutrition. Symptoms is preoccupation with weight, food, and body image, and unhealthy eating behaviors. So if at all you're a parent, you have an adolescent or a teenager, check them, kindly check with that, because most of them undergo that and they will do it behind your back. So you can take them for nutrition in counseling and sometimes therapy. And if it's very extreme or severe, they can get medication. We also have personality disorders. That's why people sometimes they say, kudil na fulani ni ngumu. It's because those people have personality disorders. So you have to be emotionally intelligent to be able to know how to deal with such a person. So personality disorders, this one includes borderline personality disorder, narcissistic personality disorder. I'm sure you've heard about narcissism, people who manipulate others. It is a mental disorder, actually. And as a person, you need to know that so that you do not fall prey to these narcissistic personalities. So symptoms, they are intense emotions, unstable relationships, distorted self-image. Like if they are in a congregation, probably in church, they have two faces. In church, they portray a different image. When they are in their homes, in the house, they are totally different people. Sometimes when you talk to women huku nje, utasikia wakisema wacha huyu anajifanya ni kanisani. Akifika kwa nyumba, he's someone else. That is a narcissist, or that is a person who has personality disorders. So if you tend to get someone like that, kindly just tell them to seek some mental help. They will be sorted out. Another one is attention deficit or hyperactive disorder. Last year we had some visitors who came. They talked about this attention deficit and hyperactive. Mostly it's children. It occurs in childhood. It's a neurodevelopmental disorder, often diagnosed in childhood, but can persist into adulthood. You've heard about autism? Mmesikia about autism? Yeah. So that is also one of these attention deficit, whereby the symptoms, there is inattention, they cannot stay calm, There is hyperactivity, there is impulsiveness. I'm sure you've seen these kids around. We live with them in our estates, we live with them in our plots, they're there. So there is treatment for them. If you probably notice, maybe your neighbor's kid has the same, you can advise them to go for a mental health checkup, because some of them don't know. Wanasema tu mtoto huwa anasumbua. Mtoto haezi kaa mahali pamoja. No, it is not normal. There is substance use disorders. This one involves the harmful use of substances like alcohol and drugs, and especially our youths. Watoto wetu, they are doing drugs, which is, it's alarming. The rate is alarming. Parents have given up. Right now, if you walk to psychiatric units in the hospitals, it's sad because 70% of those people are there are young people because of drugs. So I tend to pause because I don't know, it's really hard to deal with this. I don't know what to do about it. But anyway, there is treatment. It involves the harmful use of substances like alcohol and drugs, the cannabis, cocaine, heroin. But sadly, the people who even sell these drugs to these youths are just parents, you know. It's very sad. So the symptoms are loss of control and continued use. They get addicted and they cannot stop using the drugs. Even in schools, they use the drugs. So you need to be very careful as parents. And nowadays, they have even devised so many ways of using the drugs. They don't take it. Hautasikia harufu ati mtoto anakuja kwa nyumba amelewa. You will never. So if it's the girls, they use their pads. You can imagine, they use the pads, they put the drugs there, and they are able to, the drugs get into their system. So we unafikiria mtoto wako ni mzuri, hatumie hizo vitu, but you just don't know what they are doing. So there is counseling. Normally we need to give them health talks about this, tell them the dangers of the drugs. We can counsel them, we can take them to rehabilitation, and mostly we also give medication. So this is just a disclaimer. Mental health conditions are not a sign of weakness. Don't feel like you're really weak if you have any of this, but rather a medical issue that requires attention. If you feel you have any of the symptoms that I've talked about, seek medical attention. Early intervention can make a significant difference, and treatment always involves a combination of professional support. There is self-care, and where necessary, you are given medication. So if you know someone who is struggling, reaching out to a therapist or a counselor or any mental health hotline, you can always just see us around so that we can help you with treatment, and we can help connect you with the professionals so that you can be helped. Up to there, is there any question? Tumeelewa? Kuna swali?
Nashukuru. My question is, according to the presentation, is it like all of us are suffering in mental disorder in one way or the other one? Because we have mood swing, we have depression. So at what point that you can say you are normal, you're okay?
Given the life that we are going through right now, our situation actually in Kenya. Nani hana stress? Atuambie tu. Nani hana mental issue? No, Henry, you don't have mental issues. Hata hiyo yenye tunakaa, news peke yake, the news that we watch every day, 90% is negative thoughts. Is it true or not? It's either we are looking at abductions, people have lost their children, accidents on the road, a high cost of living, a suicide. All this, we are exposed to that. So basically, all of us have mental disorder. What do we need to do? We need to walk in a hospital and get checked. Siku hizi vile tu unaenda kucheck your blood pressure is the same way that you walk in a hospital and you get checked for your mental status. And please do it 6 monthly. If not yearly, you can do 6 monthly. Any other question? I hope you answered. Okay. But stop, don't do self-medication. Don't self-medicate. Because even before you get to medication, there are some steps that you go through before you go to medication. So usisikia ati rafiki yangu alipatiwa hii dawa ndio akwe analala, apate usingizi. So pia we unaenda unasema nipatie hiyo dawa niliona rafiki yangu alipewa ndio alale, pia we unaitumia. Don't. Because it's either maybe you are worsening your situation or you even don't know what you are treating. That's why there are professionals in the hospitals. Just go in and get help. If there is no any other question, Mungu awabariki sana, and kindly let's take care of our health. We can start by doing simple things like physical activities. That one everybody can do, just to take care of your health. Physical activities. Kimbia, tembea, because most of us, we are always in the car. When you get to your workplace, you're sitting down, so you're actually not exercising at all. You can do physical activities. You can also practice good nutrition. Check your diet. Avoid drugs. That one you can do as a person, at a personal level. Do not use alcohol. Do not use the drugs. You take care of yourself. Those are things we can do. And avoid negative thoughts. Personally, I don't watch news. Sijui kama kuna mtu mwingine afanye hivyo. I don't. For my own sanity, I don't watch news. And it has helped me. Because ukitoka hapo, you have pressure. Kichwa yako imejaa pressure because of the things you have done and you have no control over. So you can learn how to do that. Otherwise, mbarikiwe sana.
Thank you, Sister Timina. Na niko na kaswali. Kuna mtu hapa anakosa usingizi. Niko na dawa. Kuna mtu hapa anakosa usingizi akilala. Hawezi lala 8 hours. Kunayo? Mimi ni mmoja yao. Hakuna mwenye mnalala wote kama watoto 8 hours. Kama unasikia usingizi haikuji, kunywa hibiscus tea jioni kama unalala. Utalala vizuri kama mtoto. Mewapatia dawa. Mmefurahia mafundisho ya leo? Yeah, next time kuna topic tumeongea na watu na nimeona imesaidia wengine. Tutaongelea kuhusu HIV, AIDS and kifo. Tutaongea juu ya kifo. Next time kuna watu hapa hawajafiwa na familia yao na hawajajua kifo ni nini na wanasikia kwa jirani ni matanga. So next time tukipatana tutaongelea kuhusu kifo na HIV status. Kuna mtu anajua status yake? Hapa siku hizi ni rahisi kwenda tembea kwa daktari ujue HIV status yako. Otherwise nimekuja kugundua sisi wa Sabato pia tunanyamazia sana juu ya AIDS. Hatuongelelei. Tunanyamaza tu. HIV iko juu sana sana kwa kila mtu, lakini vizuri pia ujue hali yako. Wengine tunaenda kupimwa kila wakati. Jua hali yako ndio utajua vile utakaa. HIV status yako ni muhimu. Na kitu ingine pia, wengi wetu tuko na insurance. Tembea kwa daktari ujue your blood group. Ukijua blood group yako, utajua ile chakula unaweza kula inakuaffect ama unakula inakupeleka vizuri, na kulingana na blood group yako. Kila mtu atakufa na kifo yake kulingana na blood group. Kwa hivyo kifo iko, tutaongelea juu ya kifo next time. Ujue ndio ujue, mimi nilikuwa na hii, nilikuwa nasikia hii, niliambiwa nikule hii, nisikule hii. Sisi sio wagonjwa, hii chakula tunakula na ile damu blood group tuko nayo ndio tunakufa. Kwa hivyo kifo iko, tusikufe kama hatujui. Jua ya blood group. Kuna chakula unaweza kula inakuaffect, nyingine unakula inakupeleka vizuri, ujue vile utakaa. Mmefurahia? Kabla hatujamaliza tunapatia elder wetu nyingi, ukifikiria hata utameza dawa. So kuna ile lazima ukunywe, na chakula pia ni muhimu. Your diet ni muhimu. Mimi niko na example ya my mother. Tulikuwa tumempatia madawa mingi, wakati mwingine tunaona huyu mama anakufa. Tukaenda kwa daktari, tukamwambia, akatupatia meal plan. So huyu mama yangu tangu tupunguze madawa, chakula diet ni muhimu, huyu mama ako anaelekea 100 na. Kwa hivyo sio lazima tuishi kwa madawa, tukule diet ndio tusikuje kukula dawa kama chakula. Tukule diet pia ni muhimu.
That's a good question. It depends with the condition that you have. And what I advise my patients is, if you can stick to one doctor, walk the journey with that doctor. He knows your condition. He knows the drugs that you are in. And because sometimes, if your situation worsens or your condition worsens, they can change the medication or they can add some more. But hii tabia yenye you keep going, hopping from one hospital to the other, one hospital to the other, of course you will get different doctors. And these doctors, and if at all you're going to a different hospital, if you have your medical notes, carry them with you, so that when you go there, you're able to show this doctor that this is what I have been having, this is the condition that I'm treating, and you are able to be given the right prescriptions. I know what you're talking about. You will hop from this private hospital, they give you so many medications, and truth be told, sometimes it's business. Because with the insurance, my friend, we want that money. So, tunaangalia insurance yako, hii ni Britam, iko na pesa, you will leave us with 20,000. So, watakupatia hata dawa zenye hauhitaji. So, and again, that is 1. 2, seek specialized treatment. We have specialists for every condition. We have physicians, and even within the physician level, we have gastroenterologists, we have cardiologists. So depending on what you're suffering from, we have, if it's a skin condition, we have dermatologists. You can go to a specialized doctor. With that, you will avoid so many prescriptions and so many drugs that can actually just harm you. I hope you answered. Okay.
Mnasemaje kwa madaktari wetu? Ni wangapi wamebarikiwa? Okay, la sio hivyo. Tutaenda kufanya ombi la mwisho wakati huu ili tutawanyike kwa groups zetu. Wazee watakutana kule nje, wamama watabaki hapa ndani. Then vijana wakutane huko kwa conference room. Tachukua nafasi ya kipekee ili nikaribishe Elder Maka huko aje atufungie kipindi huo na maombi. Karibu Elder.
Tusimame tafadhali tukipata ombi ili tutawanyike kwa departments. Let us believe as we pray. Our Lord and our God, we want to thank you. We want to thank you for the afternoon programs. We want to thank you for our doctor who gave us information on dentistry. We want to thank you also for our sisters who have given us information on mental health and how we can be able to use nutrition as a way of safeguarding ourselves. Father Almighty, may this knowledge that we have been able to gain be a continuous message that keeps on assisting us even as we live through this difficult and challenging life. Father Almighty, as we break for the departments, we want to ask for your presence, we want to ask for your favor, we want to ask for your mercy, that even as we go and discuss the issues that pertain to the development of this church and also to move this church to the next level, we want to ask you that you will be able to give us the wisdom and the insight to be able to discuss things which are useful and which can be able to assist us to make our life better. Father Almighty, we want to thank you for the health department that have organized today's programs, that you continue to bless them, that they can be able to give us even other programs of this kind in the future. Father Almighty, safeguard us, protect us, and help us to go through the remaining bit of the programs for the Sabbath. We pray in Jesus' name. Amen.
Asante, tukutane kulu. Then tupeane 1 hour, then turudi tumalize.